This video will demonstrate how a medical officer will use the EDS to create a discharge summary. The Enterprise Discharge Summary System, or EDS, is a computerized patient discharge summary which imports information automatically from various Queensland Health source systems such as IMR, ELMS, AusLab and Hibiscus. Click the EDS icon from your desktop or from your Start menu and then log in using your Novel username and password. I'll quickly navigate the home screen here. At the top here we have Switch To, where you can switch between EDS and the viewer. We have Search, which is best practice for locating your patient's chart. As we have multiple filters available here, it's best practice to use at least 3 identifiers. Clicking back to the home screen, we'll see here that we'll find system alerts here. Any recently viewed discharge summaries will appear here, and any recently viewed incomplete discharge summaries will appear here. You can also type your patient's UR number up into the UR box. On the left-hand side of the screen here, we'll see the list of encounters. The emissions will load on the left-hand side in reverse chronological order, and they display the EDS status. For example, we have interim, amended, we have not started, and you might also see finalized as well. The current or most recent inpatient admission will always be at the top here. We have tabs across the top of episode, which interfaces information from Hibiscus. Medical history will interface information entered in the IMR. So too will procedures. Investigations will interface from AusLab. Medications from ELMS. Adverse reactions and alerts from IMR, and also management plan we will free text into. To start a discharge summary, we can do that in one of 2 ways. First, we check to make sure that it says not started here, so we know that this hasn't been started. We can also see that there is an icon here with a plus sign. One way that we can start a discharge summary is to click onto this icon here with the green plus sign, and that will start the discharge summary. However, in certain areas it is the administration officer's responsibility to start the discharge summary, in which case you would click on this icon, which would appear with a pencil on it once it has been started, and we'll see that shortly. I'm clicking on the icon to start this discharge summary, and now we can see here that the status has now changed to interim. Going back to the episode tab, you'll see that now we're able to enter in some more information free text if appropriate. Clicking on the medical history tab, we can see in this particular discharge summary that the principal diagnosis hasn't been entered, neither has the secondary or previous medical history. It is a very important point here to mention that if you enter this information into the IMR, it will actually populate the discharge summary for you. So every time a patient is discharged, the information will automatically pull through here for you, and you won't need to enter it every single time. I'll quickly demonstrate how you would do this. One way you can do this is from the alerts and problems section of the patient's chart. You can add in a diagnosis from here by clicking on Add. You can free type in the diagnosis and then select it from the list. If the community-acquired pneumonia was our primary or principal diagnosis, we would click into the type drop-down and we would select principal. If you were to do OK and add new and add in secondary diagnosis, please ensure that you change the type for those ones to discharge diagnosis. We can just have one principal diagnosis. I will now click OK. That is now in the patient's chart, and that will automatically interface into the patient's discharge summary. So too, if I was to enter in chronic conditions, I would click on Add. I could type in the chronic condition from here. And this will remain in the patient's chart for all future encounters, and this will pull into the patient's discharge summary, so you don't need to manually enter it every time. Alerts and problems is one way that you can enter in your diagnosis and chronic conditions. The other way, and the best practice way, is to do so from Doctor View by going to your problem list. I'll refresh my screen here. And we can now see that we have got the community-acquired pneumonia as the diagnosis because it says this visit, and we have the hypertension as chronic. If you are working from your Doctor View and you click Add New as this visit, you can enter in your diagnosis from here. I'd select bronchitis, and again we need to make sure that we have the correct diagnosis type here. So we're able to edit it by clicking onto the diagnosis name, clicking on Modify, and then if this was the discharge diagnosis, we would leave it as discharge. If it was the principal diagnosis, we'd change it to principal. If you want to add in your chronic conditions from here as well, we'd click on chronic, and we could type in our chronic conditions here too. Because we have these chronic conditions now in the chart, they will appear in all future encounters and all future discharge summaries. Going back to EDS, we can see that because that wasn't entered into this patient's chart, we actually have the information here is blank. So we have to type the information in. So we would type in the reason for admission or the presenting problem. So we could type in shortness of breath, for example. Had you entered the principal diagnosis in the IMR, it would automatically populate here for you. If you enter it manually, you'll need to click on the plus sign here. You can type in any relevant comments, and it shows the source as manual. I will now click out of this box, and we now have the diagnosis entered here. I can enter in secondary diagnosis by clicking on this icon again and entering in a second one in the same way that I entered in the principal diagnosis. Then we've got the previous medical history. If it has been documented once in the IEMR through the Alerts and Problems screen or Doctor View, the information will automatically pull through here. However, if it's not entered in there, you will need to manually put them through here. And we'll click on the plus sign to do so. We can first of all put in the date, and we can choose to show the full date, or we could choose year and month only or year only. So for example, if this patient has told you that they've had hypertension since 2008, you could pick year only, and you could select the year. You can type in hypertension here, and you can put in any comments here. A training point I'd like to discuss is that it is recommended that you only add one condition per cell. It is possible to press enter and to continue to write additional chronic conditions. However, it's recommended that you use one cell per condition, because if you add in comments here and you'd like to edit it, it's much easier and accurate to edit it if there's one cell per chronic condition. So this is the best practice way of doing so. We click out, we click the plus sign, we add in an additional one. It's important to note that if you entered any comments into the Alerts and Problems screen, they would pull through here for you, and so you'd be able to see them here, and you can also edit them from here as well. We have the Inpatient Clinical Management field, and this is a free type field here. We can type into complications. Before moving on to the Procedure tab, if you have entered multiple diagnoses as primary diagnosis, you can only select one to be the primary diagnosis in the discharge summary. Let me demonstrate that. I've entered in another diagnosis under primary diagnosis. However, it has now selected the bronchitis. If it is actually the community-acquired pneumonia I want it to be in the discharge summary, then I'll click into that checkbox there, and you'll see it deselects the bronchitis. Moving on to the Procedure tab, if the patient has a procedure which has been documented electronically in the IMR, or as you see here, ORMUS, you will see it pull through here. And again, we have the option to click onto the checkbox here to include it into the discharge summary. We have an edit pencil, which will allow us to edit the row and enter in more information. We also have the magnifying glass where we can see the details of that documentation. To include it, we'll click the checkbox. Moving to the Investigations tab, and again we can view additional information by clicking onto the magnifying glass, and we can include investigations by ticking the click box. Medications will interface from ELMS, and again you can edit, you can tick or untick, and anything ticked will pull through into your discharge summary. We have alerts and adverse reactions. Anything that has been documented electronically and interfaces into the discharge summary will be here with the option to tick or untick. You also have the option of declare why no alerts are included for the patient. So if the patient has no alerts, the system will force you to document that information. So if there was no relevant alerts, you would tick into that box there, for example. On the Management Plan tab, this is where you'll document your recommendations to the GP and the patient, and the nursing staff will complete the care plan summary. So for example, we could type into follow-up arrangements here, and we could type in the person's name, the service requested, and any comments here. Or if there was no recommendation to the GP, you could click into the no specific follow-up. So again, the system does force us to put in whether or not we have recommendations for the GP. Also, we have recommendations for the patient and the care plan summary, which will be completed by the nursing staff. Once we've completed the discharge summary, we'll click on the save icon. We can view the discharge summary by clicking on this icon here that looks like a PDF. As I scroll through, you'll see the information has been populated into the discharge summary that we ticked, for example, the surgeon's note, the medications, etc. Next, I'm going to talk about the recipient list. If we click onto the recipient list here, this will tell us who's going to receive a copy of the discharge summary. We can see the patient gets an electronic copy to their health record, the patient gets one by post, and we have here the referring doctor. It is important to talk about this icon here, which is the blue outline of a person with the question mark next to it. And when I hover, it says the address book lookup has not yet been performed. So the system just needs us to pull through and make sure that the data is correct for the doctor. We can do that by clicking on the magnifying glass. Before I do so, let's quickly see that Donna Armstrong is the name, we have the address of the clinic, and we have the delivery type as post. Now let's click onto the magnifying glass. Donna Armstrong's name does come up, so we can click there. And now you'll see that that is going to be delivered electronically. If you want to send a discharge summary to an additional clinician, we can click on this icon here to add in additional recipients, and we can put in the doctor's name. Select the doctor from the list, and we can now see that that doctor now appears in the list, and we have the drop down option to select their recipient type. Once the doctor has completed the discharge summary, they can click on this finalize icon here. This pop-up box gives us a warning that if we were to click continue here, this step will finalize and electronically distribute the discharge summary, and it asks to make sure that you've previewed it prior to proceeding. Are you sure that you want to finalize and distribute? I will click continue. Once it has been finalized, we'll have the option to print out the distribution report outlining who, where and how copies will be distributed. A copy will also be scanned into the patient's electronic medical record. This has been an overview of how a medical officer will use the Enterprise Discharge Summary System. Finally, we'll discuss some best practice tips and also discuss terminology. The first tip is to enter any diagnoses or chronic conditions directly into the patient's chart. You can do this in one of two places. If you use DoctorView, you can do it from the Doctor Navigator menu. You can click on Problem List, and over here to the right, you can enter the diagnosis by selecting this visit, or you can enter any chronic conditions by changing this filter to chronic. If you don't use the DoctorView, you can access the Alerts and Problems screen directly from the patient's chart menu. You can add in the diagnosis here, And you can enter in any chronic conditions or alerts by enter them in the problem section down here. This table here will show the IMR to EDS mapping, and it will also allow us to discuss terminology. If you enter a diagnosis into the IMR and change the diagnosis type to principal, it will interface into EDS into the principal diagnosis field. If you enter a diagnosis into the patient's chart with any other type other than principal, it will flow through into EDS into the secondary diagnosis fields. Any chronic conditions that you enter into the patient's chart will also flow through into the secondary diagnosis field. But any resolved or inactive chronic problems or conditions will populate into previous medical history in EDS. The next tip is to only have one principal diagnosis. On this slide here, we have a screenshot taken from PowerChart and we have a screenshot taken from EDS. We can see on this screen here we have two diagnoses entered for this patient. The first diagnosis has a type of principal, and you can see that that maps through into EDS into the principal diagnosis section, and we see the source as IMR. The second diagnosis has been left at the default of discharge, and you will see that that has populated into EDS into the secondary diagnosis fields, again showing the source as IMR. Please correct any errors or make updates in the IMR. If edits are completed in EDS only, the corrections or the updates will not flow back into the patient's chart, so please make sure all relevant updates and corrections are made in the IMR, as these will then transfer into EDS. And an example of this would be if you have two principal diagnoses for your patient, you'll need to come into IMR and modify the diagnosis from this screen here from alerts and problems, and then that will flow through into EDS. This will ensure that information is correct in both PowerChart and also in EDS. Finally, the address book lookup. If you see this icon of a silhouette and you see the delivery type for the discharge summary is post, please click this magnifying glass here. It will take you through to the address book lookup screen. You'll type in your provider name and a list will appear of potential search results. You can click on the appropriate one and then that will populate into the recipient list. Once I click to this name, we can now see that the icon has changed and so has the delivery type to electronic. So this will ensure that the discharge summary is sent, in this instance, to the referring doctor in an electronic format.